This is the musculoskeletal system, beginning on page 237 with anatomy. Bones are connected to muscles that contract to move the body. Joints are the spaces between bones. Near the joints are ligaments that connect bones to other bones, excuse me, and tendons that connect bones to muscles. On page 238, we have anterior and posterior views of superficial muscles in the body. The anterior superficial muscles are shown on 238, and then the posterior superficial muscles are shown on page 239. Our terminology, our combining forms, meanings, and terms. First, we have arthro, which means joint. Arthroscopy is the process of visual examination of a joint. Chondro means cartilage. Chondroma is a benign tumor of cartilage. Costo means rib. Costochondritis is inflammation of a rib and its cartilage. Cranio means skull. Craniotomy is incision of the skull. Ligamento means ligament. Ligamentous is pertaining to a ligament. Leiomyo means smooth, the visceral involuntary muscle. Leiomyosarcoma is a malignant tumor of smooth involuntary muscle. Musculo means muscle, so muscular is pertaining to muscles. Myo also means muscle. Myo also means muscle. Myosarcoma is malignant tumor of muscle. Myoso, again muscle. Myositis is inflammation of a muscle. Myelo means bone marrow. Myelodysplasia is abnormal development of bone marrow, a pre-malignant condition leading to leukemia. Osteo means bone. Osteomyelitis is inflammation of bone and bone marrow caused by a bacterial infection. Pelvo means pelvis or hip area, so pelvic is pertaining to the bones of the hip area. Rhabdomyo means skeletal, striated voluntary muscle. Rhabdomyolysis is breakdown of damaged skeletal muscle. Spino means backbones. Spinal stenosis is a narrowing of the spaces within the spine that can put pressure on the spinal cord and nerves. This often causes pain, numbness, or weakness. Spondylo means vertebrae. Spondylosis is abnormal condition of a vertebra or vertebrae. Vertebro means vertebra. Intervertebral is pertaining to lying between two backbones. A disc is an intervertebral structure. Teno means tendon. Tenorrhaphy is suture of a tendon. And tendino also means tendon. Tendinitis is inflammation of a tendon. Next is the pathology section for the musculoskeletal system. Ankylosing spondylitis, chronic progressive arthritis with stiffening ankylosis of joints, primarily of the spine and hip. Carpal tunnel syndrome, compression of the median nerve as it passes between the ligament and the bones and tendons of the wrist. Fracture, breaking of a bone. Gouty arthritis, inflammation of joints caused by excessive uric acid, also called gout. Muscular dystrophy, an inherited disorder characterized by progressive weakness and degeneration of muscle fibers. Osteoporosis, decrease in bone density with thinning and weakening of bone. Porosis means condition of containing passages or spaces. Rhabdomyolysis, breakdown of damaged skeletal muscle. And rheumatoid arthritis, chronic inflammation of joints. Pain, swelling, and stiffening, especially in the small joints of the hands and feet. Rheumato means flowing, descriptive of the swelling in joints. Laboratory tests and diagnostic procedures. Anti-nuclear antibody, or ANA test. A test in which a sample of plasma is tested for the presence of antibodies found in patients with systemic lupus erythematosus. Arthrocentesis, puncture to remove fluid from a joint. Arthrography, X-ray imaging of a joint. Arthroscopy, visual examination of a joint with an arthroscope. Bone density test. Low energy X-rays are used to image bones in the spinal column, pelvis, and wrist to detect areas of bone deficiency, also called bone density scanning, dual energy X-ray, absorptiometry, DEXA, or bone densitometry. Bone scan, procedure in which a radioactive substance is injected intravenously and its uptake in bones is measured with a special scanning device. Calcium level, measurement of the amount of calcium in a sample of blood serum. This test is important in evaluating diseases of bone. Electromyography, or EMG, recording of the electrical activity of muscle tissue. This test reveals the strength of muscles. Erythrocyte sedimentation rate, or ESR, measurement of the rate at which red blood cells fall to the bottom of a test tube. High sedimentation rates are associated with inflammatory diseases such as rheumatoid arthritis. A muscle biopsy. This is the removal of muscle tissue for microscopic examination. Open reduction internal fixation, or ORIF, surgical procedure used to treat severe fractures or dislocations. Open means that incisions are made through the skin to gain access to bones and muscles. Reduction is a surgical procedure to reposition and connect broken bones. Internal means inside the body. Fixation means to stabilize a broken bone with rods, screws, and plates. Uric acid test, measurement of the amount of uric acid, nitrogenous waste, in a sample of blood. High uric acid levels are associated with gouty arthritis. Treatment procedures. Arthroplasty is the surgical repair of a joint. Total hip arthroplasty is a replacement of the head of the femur, thigh bone, and acetabulum, the cup-shaped portion of the hip socket, with artificial parts, prosthesis, that are cemented into the bone. Laminectomy, removal of a piece of backbone, lamina, to relieve pressure on nerves from a herniated disc. Microscopic discectomy, surgical removal of a herniated intervertebral disc with an incision that is 1 to 2 inches long and visualization of the surgical field with an operating microscope. Vertebroplasty, surgical repair of vertebrae. Special cement is injected into backbones to strengthen them and to relieve pain caused by compression fractures. And then we have our abbreviations. ACL, anterior cruciate ligament of the knee. ANA, anti-nuclear antibody. C1 through C7 are the cervical vertebrae. CA is calcium. DEXA is dual energy X-ray absorptiometry. DJD, degenerative joint disease. DOMS is delayed onset muscle soreness. EMG, electromyography. ESR, erythrocyte sedimentation rate. FX is fracture. IM is intramuscular. L1 through L5 are the lumbar vertebrae. NSAID is non-steroidal anti-inflammatory drug. These are prescribed to treat joint and muscle pain. OA is osteoarthritis. ORIF is open reduction internal fixation, the surgical procedure to treat severe fracture. Ortho is orthopedics. PT is physical therapy. ROM is range of motion. T1 through T12 are the thoracic vertebrae. THR is total hip replacement. TKR is total knee replacement. And TMJ is temporomandibular joint.